Hi everyone, welcome back to our channel Nursing Verse K. Today we will discuss about the most important MCQ for the Norcet and other nursing exams. Let's start. A patient with schizophrenia is standing in the corner of the day room and says, "The silver soldiers are marching in the veins to take my thoughts." Which is the most therapeutic responses by the nurses? Option A, there are no silver soldiers in the veins, you are safe here. Option B, I don't see any soldiers but I can't see that you look very frightened. Option C, why do you think the soldiers want to take your thoughts? Option D, let's go to your room so the soldiers cannot find you. The answer will be option B. Option B. Because this response acknowledge the patient feelings. Acknowledge the patient feelings. While presenting reality, I don't see anything. I don't see anything. It's avoid to arguing. It's avoid to arguing about the hallucination or the validating it as a real, which is the gold standard in the managing the psychotic symptoms. So the answer will be option B. Next, a patient is being started on lithium carbonate for bipolar disorder. Which of the following instruction is vital for the nurse to include in the teaching plan? Option A, maintain a consistent intake of salt and fluids in your diet. Option B, switch to a low sodium diet to prevent the fluid retention. Option C, limit your fluid intake to less than 1 liter per day. Option D, take the medication only when you feel a manic episode starting. The answer will be option A. Maintain a consistent intake of salt and fluids in your diet, because lithium is a salt. If sodium intake decreases, if sodium decreases or fluid loss increases the sweating, the kidney will reabsorb the lithium instead of sodium and leading to lithium toxicity. Consistency in salt and fluid 2 to 3 liter per day is essential. So the answer will be option A. Next, a nurse is caring for a patient with anorexia nervosa. During the initiation of total parental nutrition (TPN), the nurse monitors for refeed syndrome. Which electrolyte imbalance is the hallmark of the condition? Option A, hyperkalemia. Option B, hypophosphatemia. Option C, hypernatremia. Option D, hypocalcemia. Refeed syndrome occurs when severely malnourished patient receive concentrated calorie. The sudden shift from catabolism to anabolism causes cells to rapidly take up phosphorus leading to severe hypophosphatemia hypophosphatemia, which can cause the heart failure and the seizure. Can cause. So the answer will be option B, hypophosphatemia. Next, a patient is admitted with Winkel-Crosskopf syndrome due to chronic alcoholism. The nurse anticipates administering which of the following vitamins first? Option A, vitamin B12, cyanocobalamin. Option B, vitamin B6, pyridoxine. Option C, vitamin B1, thiamine. Option D, vitamin C, ascorbic acid. The answer will be option C, vitamin B1. It is caused by the disease. It is caused by the deficiency of thiamine, severe thiamine, B1 deficiency. Administering glucose before thiamine can actually cause the neurological damage, so thiamine must be prioritized. So the answer will be option C, thiamine or vitamin B1. Next, a child is diagnosed with nephrotic syndrome. The nurse observed generalized edema, anasarca. Which dietary modification is most appropriate for this patient? Option A, high protein, high sodium. Option B, high protein, low sodium. Option C, normal protein, low sodium. Option D, high calorie, high potassium. The answer will be option C, normal protein and low sodium, because in nephrotic syndrome the goal is manage the edema and replace loss of protein. In low sodium diet helps reduce the fluid retention, while the child losing protein in the urine. A normal protein intake should be recommended. Excessively high protein can actually damage the glomeruli further. So the answer will be option C. Next, while assessing a patient with depression, the patient says, I won't have to worry about these problems much longer. What is the nurse's priority? The patient says much longer means for the short time. Option A is document the statement in the patient chart. Option B, ask the patient directly, are you thinking of hurting or killing yourself? Option C, notify the family to come and stay with the patient. Option D, administer a sedative to help the patient sleep. The answer will be option B. You have to ask the patient directly, you are thinking of hurting or killing yourself, because this is a clue to suicide. This is the suicide ideation. The priority nursing is to assess the lethality directly. Asking about suicide does not put the idea in the patient's head. It provides the space for them to disclose their intent. So the answer will be option B. Next, which of the following consider a negative symptoms of the schizophrenia? Option A, auditory hallucination. Option B, delusions of grandeur. Option C, anhedonia, inability to feel the pleasure. Option D, echopraxia, mimicking the movements. The answer will be option C, anhedonia, inability to feel the pleasure. Negative symptoms represent the loss of normal function like apathy, alogia, anhedonia, affecting, flattening. Hallucination and delusion are the positive symptoms. These are the negative symptoms, and positive symptoms are the delusion and the hallucination. These are the negative symptoms: apathy, alogia, anhedonia, affecting, fluctuating. Next, a patient is receiving magnesium sulfate for the management of preeclampsia. The nurse notes the patient's urine output is 20 ml per hour. The nurse should, option A, continue the infusion, reassess in 2 hours. Option B, increases the IV fluid rate to flush the kidneys. Option C, stop the infusion and notify the healthcare provider. Option D, prepare the patient for an emergency C-section. The answer will be option C, stop the infusion and notify the healthcare provider, because magnesium is excreted slowly by kidneys. If the urine output less than 30 ml per hour, magnesium can quickly build up toxic level. So when the urine output less than 30 ml must be stop the infusion immediately and inform the doctor. Next, in psychiatric ward, a patient becomes increasingly agitated, pacing rapidly and shouting at others. Which is the best initially nursing intervention? Option A, immediate place the patient in physical restraints. Option B, assemble a show of force with the 5 other staff members. Option C, use calm, low-pitched voice and ask the patient to go to the quiet area. Option D. Administer an IM injection of haloperidol immediately. The answer is option C. Use calm, low-pitched voice and ask the patient to go to the quiet area, because de-escalation using the least restrictive method is the first step. Moving the patient to low stimulation environment often prevents the situation from escalating to the point where restraints or medication are needed. So the answer will be option C. Next, this is an OBG questions. A pregnant woman in her third trimester in diagnostic with placenta previa. Which of the following is strictly contraindicated? Option A. External fetal monitoring. Option B. Deep palpation of the abdomen. Option C. Vaginal examination. Option D. Administer of the corticosteroids. Here they told during the placenta previa, the third trimester, never do the vaginal examination during the placenta previa, because the placenta previa cover the cervical OS. A vaginal exam can cause immediate massive hemorrhage. If you want to confirm with diagnosis is confirmed through the ultrasound and no vaginal examination. Standard precaution. This is an standard diagnosis, ultrasound. Don't or never do the vaginal examination. Thank you everyone. Please like, share and subscribe our channel.